Okay, let me start with an uncomfortable question. If you were to leave this earth right now, and I don't mean on SpaceX, would there be enough to cover your final expenses? Before we get to the end of our life journey, there are so many more financial concerns to navigate, especially as we age, from healthcare to overall well-being. Our first guest helps thousands of seniors choose Medicare plans, but they can help with so much more. Joining us with details is Justin White, CEO of Senior Health Services. And by the way, they have some career opportunities. We'll talk about that in just a minute. Good morning and welcome back.
Well, good morning.
All right. Senior Health Services, as an independent brokerage, you have over 300 agents, and you've been on the show before talking about Medicare.
Exactly. That is our primary business, but Senior Health Services, as the name implies, anything that somebody that is of senior age and above, life and health, ask your questions. We either have it or we know where to send somebody to get it taken care of.
Speaking of questions, this guy named Steve has a question for you. He goes,
Okay.
We hear a lot about the general enrollment period for Medicare from October through December. I wasn't old enough yet, but I'm turning 65 in a month. Do I have to wait until October, or are there other enrollment periods for coverage?
Oh, Steve, great question. Okay. So when you're turning 65, you're aging and you're new to Medicare, the world is your oyster. You can do whatever you want to. Because these guys, like Steve turning 65, it's a 7-month period, 3 months before the month of 65, and then 3 months after, and you can go shopping, you can choose the plan you want, so you can do whatever. Those other enrollment periods are once you're in Medicare. That one towards the end is for people that are in Medicare Advantage or prescription drug plans to make that annual change. And then there's also special enrollment periods throughout the rest of the year. So Steve, you just give a call because you can do whatever you want to.
Yeah, you say to make that annual change for the other folks, that's because life changes, right? And
That's
it changes
exactly right.
a little bit faster as we age. Life insurance service, when people pass, loved ones are oftentimes left with expenses, and it hits you sideways because a lot of people have no idea how much it costs to put somebody in the ground or in an urn, and it really wrecks a lot of families. And so life insurance is kind of a way to hedge that.
It is really, really hard. It is like buying dollars for pennies apiece. I've heard that say, because you just pay a premium and then that money will rush in when the inevitable eventually happens. And our clients oftentimes are doing it, as you mentioned before, for final expenses and funeral. But you can be very creative with it. Sometimes they'll want to leave money to a charity, or they might want to leave some money for a grandkid. I mean, you can do pretty much what you want to, but final expenses are the main thing.
Yeah.
And that's for them. And then, of course, for replacing income for the younger folks and business planning, it's just almost endless.
Yeah, paying off things like perhaps they had a car loan, a home loan, if you want to own that home, all that type of stuff. It starts with a conversation, and that's the toughest part, because people don't like to think of somebody not being here, but you have to prepare for not being here.
People hate talking about it.
Yeah,
They just do. I don't like talking about it because we don't like to consider that, but just imagine your face on a pickle jar at the convenience store. That's, or people passing the hat at church.
Yeah.
That's the kind of stuff that you want to avoid. And that's the conversations that we have. It's just like, hold your nose and have the conversation about it, because it's not that bad. And it's just something that your family will be so grateful that you did.
Plan for the end of life and then go on living the rest of your life.
Exactly.
There's no specific age to do this, but obviously as we get older, it becomes more important.
The younger you are looking for life insurance, the more affordable it's going to be. But as you just mentioned, I mean, all ages for the most part. Now you get up into the upper ages and it gets harder.
Well, I'm 150.
Exactly.
It's coming soon.
Exactly. High five for that.
But also purchasing after major life events. When you get married, things change. When you have kids, things change. Buy a home or get divorced, things change.
Life insurance is about covering financial risks. So you got a mortgage, you got an auto loan, you've got kids that you want to make sure that they go to college or something like that. But it's just again, it's almost endless.
And there's different types that you can walk us through. That's one of the things that y'all are so good at, because things get confusing to us. We don't understand it. You do. We don't have to understand it.
Exactly.
Term life insurance policy.
Term is the cheapest of all because it terminates. That's the way you do that. Term terminates. So that's the cheapest, but you've also got the permanent for permanent risks like death and taxes and things like that. Final expenses. There's whole life, there's universal life. And we just match the exact type of coverage to the person that we're talking to make sure they're not overpaying and have the most appropriate coverage.
Yeah. All right. These are all necessary things. And if you're a baby boomer, you probably have already retired or you're about to retire, right? So we're having a big group of people coming into the fold, and you need to answer that call. You're recruiting agents right now. I mentioned earlier that you actually have a career opportunity.
Yes, we were absolutely overwhelmed in the fall with so many people because the Medicare changed a lot and prescription drugs are all over the place and plans changed or canceled or whatnot, and so our phones melted, and so we just need help. So that's what we've been getting the word out.
You need help with the new phone system, or you need help with agents?
Well, yeah, both.
Both, yeah,
but mainly the agents, right? But because the phone system can be handled very easily, but joking. But yeah, if people are looking for a new career and they like dealing with seniors and they like problem solving and helping people through this process, fabulous. That's who I'm looking for.
Yeah. All right. So what do they go through when you're looking for them? Obviously, it starts with a call or an email to you, right?
Absolutely. Just call the office. We're doing webinars where they can just sit in the comfort of their own home and just watch, because I'm going to go through that thing in great detail. And they will know by the end of that webinar whether this is something they want more information on. And that's what we're looking for. We want to make sure that if it's a fit, when they come in, it's an absolute fit for them. So come to a webinar, and if you want a follow-up call, we'll absolutely do that.
And this could be somebody who this is the start of your career, or somebody who's had other careers, is retired, and realized they're not done working yet.
Exactly. So whether it's getting extra money or you're looking for a complete career change, you want to blow it up and form an agency, I mean, all of that. I don't know of another place where if it's for you, it can be a big financial game changer for folks that get involved.
When you say if you're looking for extra money, can this be a part-time job?
Absolutely. Absolutely. A lot of people start part-time.
Yeah, and the good thing is it gives you the flexibility in your schedule. You can be your own boss, but the skills needed, you got to be a sales-minded self-starter.
Exactly.
Enjoy helping other people, because you're dealing with people, and also having patience, because you're dealing with people who say, explain this to us, right? And a heart for customer service. Is there a deadline to join?
Not really. I mean, the best time, our big busy time, is towards the end of the year, so this is the absolute perfect time to get in, but honestly, Deborah, any time is good.
Yeah, all right. What's the biggest mistake people make in their senior years?
You know, like Steve, he came in there, the possible mistake. Steve asked the question, which is awesome. So when you're wondering about something, ask, call. You have a problem, call. Because there's almost always something that we can find to make an adjustment on, or at least let you know what solution is and when we could do it. But most of the time, if there's a problem, we can solve it with just using the tools that we have. So don't wait till the fall. Just you have an issue, call us.
Yeah, I think I heard a song there. If there's a problem, yo, I'll solve it. Okay, the next time we introduce you, we're going to have that song as you walk on. Justin, thank you so much.
It's my pleasure. I love being here.
All right. As stated, Senior Health Services offers more than just Medicare consultation. They also help with life insurance plans. And if you are looking for services or would like to join their team, give them a call. There's a number right there on your screen, 281-894-7540. Again, that's 281-894-7540. You can also visit their website at seniorhealthservices.com.